Have you ever felt a sudden shortness of breath, chest discomfort, or cold hands and wondered if it could mean something more? Heart disease is a silent killer, claiming millions of lives every year, often with little to no warning. What if we told you that recognizing 7 key symptoms could make all the difference? Cardiovascular disease, often stemming from clogged arteries, is the leading cause of death globally, accounting for nearly 18 million lives lost annually. These numbers are alarming, but the good news is that early detection and proactive measures can help reduce this risk significantly. In today's video, we'll uncover the 7 warning signs of clogged arteries that you should never ignore. Some of these symptoms might surprise you, especially number 5. It's so common that you may have already experienced it this week. By understanding these subtle yet crucial signals, you could save your life or the life of someone close to you. Just a quick reminder, we are not medical doctors. This video is for informational purposes only. Before we dive in, don't forget to hit that like button, subscribe to Health InfoHub, and turn on notifications to stay updated on all our latest health insights. Now, let's get started. 1. Shortness of breath. Shortness of breath, or dyspnea, is often an overlooked but critical early warning sign of clogged arteries. When your coronary arteries are narrowed or blocked, your heart struggles to pump blood efficiently, leaving your body starved of oxygen. This shortfall impacts how your lungs, heart, and muscles work together, resulting in difficulty breathing during activities that previously felt easy. Have you noticed feeling out of breath while climbing stairs, walking short distances, or even sitting quietly? It's easy to dismiss this as fatigue or aging, but this symptom could indicate coronary artery disease, especially if it occurs without exertion. Why it happens. The heart's coronary arteries are responsible for delivering oxygen-rich blood to the heart muscle itself. When these arteries are narrowed by plaque, a sticky combination of fat, cholesterol, and other substances, blood flow becomes restricted, reducing oxygen availability to the body's tissues. Who's most at risk? Women and older adults should be particularly vigilant. Studies show that women often experience breathlessness without the classic chest pain associated with clogged arteries, making the condition harder to diagnose in its early stages. Real-life example. Consider the story of Mary, a 62-year-old retired teacher who began feeling unusually out of breath during her morning walks. Assuming it was age-related, she ignored the symptoms for months until a routine checkup revealed she had significant arterial blockages. Thankfully, early intervention saved her from a potential heart attack. What you can do. If you're experiencing persistent or unexplained shortness of breath, consult your healthcare provider immediately. Simple diagnostic tests like an echocardiogram or stress test can reveal if clogged arteries are the culprit. 2. Chest pain. Chest pain, also known as angina, is often the most recognizable sign of clogged arteries. This discomfort, often described as pressure, squeezing, or tightness, occurs when your heart isn't receiving enough oxygen-rich blood. Types of chest pain. 1. Stable angina. This type occurs predictably during physical activity or emotional stress and subsides with rest. 2. Unstable angina. This is more severe and can occur unpredictably, even at rest. It often signals a heart attack and requires immediate medical attention. Atypical symptoms in women. Women and those with diabetes may experience silent symptoms like nausea, jaw pain, or extreme fatigue instead of the classic chest pain. This underscores the importance of paying attention to less obvious signs. If you experience chest pain, especially if it radiates to your arms, neck, or jaw, seek medical help immediately. 3. Temporary vision loss in one eye. Sudden vision loss in one eye, or amaurosis fugax, is a startling symptom that could indicate blocked carotid arteries. These arteries, located in the neck, supply blood to the brain and eyes. When they're obstructed, blood flow is compromised, leading to episodes of vision loss. How it feels. You might notice a curtain-like shadow descending over your vision, lasting a few seconds to minutes. While that often resolves quickly, it's a serious warning sign of a possible stroke. What's happening in your body? Carotid arteries can become clogged with plaque, increasing the risk of transient ischemic attacks, TIAs, or full-blown strokes. Vision loss occurs when these blockages temporarily reduce blood flow to the retina. Statistics to consider. Every year, nearly 15 million people worldwide suffer from strokes, with 5 million resulting in permanent disability. Addressing clogged carotid arteries early can significantly reduce this risk. What you can do. If you experience sudden vision changes, don't wait. Consult a healthcare provider immediately. 4. Pain in the calves, thighs, or hips. Pain or cramping in your lower limbs during physical activity, which disappears with rest, is a classic sign of peripheral artery disease, PAD. This condition results from atherosclerosis in the arteries supplying your legs. Why it matters. PAD is not just about leg pain. It's a red flag for systemic atherosclerosis, indicating that arteries elsewhere in your body, including those supplying your heart and brain, may also be affected. Actionable steps. Early diagnosis of PAD through a simple ankle brachial index test can help prevent complications. 5. Lower back pain. Lower back pain is one of the most commonly overlooked signs of clogged arteries. When blood flow to your spine is restricted, the discs in your back may deteriorate, leading to chronic discomfort. Additional symptoms. Men may notice related issues like erectile dysfunction, while women might report pelvic discomfort. Preventive measures. Regular cardiovascular checkups can help identify the underlying causes of lower back pain, potentially saving you from future complications. 6. Cold hands or feet. Do you often feel cold in your hands or feet, even when the weather is warm? This could indicate poor circulation due to blocked arteries. What causes this symptom? Peripheral arteries, responsible for delivering blood to your extremities, can become narrowed by plaque. Reduced blood flow leads to coldness, numbness, and sometimes even discoloration. What you can do. If you notice these symptoms, consult a vascular specialist for a thorough evaluation. 7. Fatigue and dizziness. Persistent fatigue and episodes of dizziness may signal clogged arteries. When your heart struggles to pump blood effectively, your body lacks the energy it needs to function optimally. How to manage it. Lifestyle changes like a balanced diet, regular exercise, and stress management can improve your cardiovascular health and reduce fatigue. Clogged arteries don't happen overnight, and recognizing the signs early can make all the difference. Whether it's shortness of breath, chest pain, or fatigue, these symptoms are your body's way of signaling that something might be wrong. Take action and consult your healthcare provider for a thorough evaluation. Health disclaimer. Keep in mind that we are not medical doctors, and this information should not be considered medical advice. This video is for informational purposes only. Always consult your doctor for personalized medical advice and treatment. Before you go, if you found this information helpful, give this video a thumbs up, share it with your loved ones, and subscribe to Health InfoHub for more insights. Don't forget to check out the videos on your screen for more health tips and advice. See you next time.